Hello everyone and welcome to another day of high yield USMLE questions. So today we will be talking about neurology. So a 27-year-old female patient presented with left upper extremity weakness. 7 months ago, she started having stabbing pain in the face with slight touching of the face or chewing. And 5 months ago, she had an episode of bilateral lower limb weakness. Touch, temperature, and vibratory sensations are decreased in the left upper extremity. A vitamin deficiency, which of the following is a risk factor for this patient's condition? So first of all, we need to know what is going on with this patient. So here, if you look at it, you are getting a lot of neurologic deficits, and also those neurologic deficits are in different areas of the brain. So this is called disseminated in space. Also, they are at different times. Some occur 7 months ago, some occur 5 months ago. So this is called disseminated in time. So when different neurologic manifestations present with different timeline. So 7 months ago, she had trigeminal neuralgia. Remember, here you're getting slight touching of the face, there is like this stabbing pain. And also 5 months ago, she has bilateral lower extremity weakness, which is a completely different area from the one the patient is presenting with right now, which is the left upper extremity area of the brain. So this is definitely multiple sclerosis. The patient is having multiple sclerosis here. So because the lesion is disseminated in time and space, and that's all you need for diagnosis clinically. But then obviously the mainstay for diagnosis is then to go on and get an MRI to confirm it. And so now the thing is, they're now talking about the risk factors for multiple sclerosis. Like, there is a vitamin deficiency that occurs with multiple sclerosis. So if that vitamin is deficient, which of the following is going to occur? So let's see. So first they said beta spots. So these are going to be seen with vitamin A deficiency. So remember, vitamin A deficiency is not a risk factor for multiple sclerosis. So this is not going to be the right answer. But remember, they may give you a question where fat soluble vitamins are deficient. So then in that case, they can give beta spots, because the fat soluble vitamins include A, D, E, and K. So, and conditions like malabsorption, like celiac disease, those will be the conditions that you can see this vitamin deficiency in. Then we have hypophosphatemia. So this will be the right answer, and this is vitamin D. So remember, again, this is a fat soluble vitamin. So conditions that are gonna cause fat soluble vitamin deficiency, like primary sclerosing cholangitis, the causes of obstructive jaundice, because bile is needed for fat soluble vitamin deficiency, and primary biliary cholangitis, so our malabsorption, like chronic pancreatitis. So these all are gonna cause deficiency of these vitamins A, D, E, and K. So they can give you beta spots or night vision loss, or for vitamin D they can say weak bones or osteoporosis, and for E there can be like hemolytic anemia. For vitamin K they are going to say like bleeding tendency and those kind of things. So here it is vitamin D. So remember, the reason that vitamin D would cause multiple sclerosis or is a risk factor for multiple sclerosis is because it has a role in immunity. So it actually helps with the T and D cells, D cell function. It has an immunomodulatory effect there. So that may be the reason. So that is the right answer here, the B. And then memory loss with diarrhea, that they're here are talking about the here this is the wrong answer. So here they are talking about niacin deficiency, which is pellagra. So for pellagra, remember 3 things they like to test on: Hartnup disease, Hartnup. So you get a lot of exclusion of tryptophan, and tryptophan is a precursor to niacin. So if niacin is deficient, you get pellagra. So niacin in Hartnup is lost. It is lost. So then number 2 is the carcinoid syndrome. In carcinoid, you get a ton of serotonin formation, and remember, tryptophan also forms serotonin, and it also forms this niacin. But the thing is, if you get a tumor that or syndrome that is producing a lot of serotonin, all of this is going to be shunted here, and nothing is left for the niacin, so you get niacin deficiency. And the third is isoniazid. So remember, isoniazid opposes the effects of niacin. So that causes the deficiency in isoniazid use. So these three conditions you should have in mind for niacin deficiency. So you get diarrhea, dermatitis, the 3D: diarrhea, dermatitis, and dementia. The 4D is death. So then we have the hypersegmented neutrophils with peripheral smear. So remember, this could be two things. This is the wrong answer. So it can be folic acid deficiency, or it can be vitamin B12. But you guys are going to be thinking about vitamin B12 and saying that it can cause lower limb weakness, and with the subacute combined degeneration that it causes. But remember, these features of subacute combined degeneration are not going to be disseminated in space and time. You're not going to get the trigeminal neuralgia. You're not going to get these features of just like you disseminated in time and space. So in what happens is in subacute combined degeneration is that you get the spinocerebellar tract involved. So you get the cerebellar signs like falls and those things, dysarthrokinesia, and then corticospinal tract, you get spasticity, you get hyperreflexia, and then for D is the dorsal columns, like decreased vibration sense so decreased vibration sense. But these features are not going to be disseminated in time and space. So hope you like this video, and if anyone requires tutoring, can you email me here? And also, if these videos help you in any sort of way, so you can do this sweet gesture and support the channel here and buy me a coffee, and link in the description. Thank you for watching.